Hi everyone. In this video I'm going to go over cleaning your earplugs, putting them in your ears, taking them out, and some other considerations. So grab your earplugs and let's get started. Inside this package you'll see you have your custom filtered earplugs. Okay, so I'm going to go over everything you need to know in terms of use and maintenance. But I want to go over a few things first. If you've seen me lecture, you probably remember me talking about this, or if you've had an individual appointment with me, we've talked a lot about ear training. So a new pair of earplugs is kind of like a new pair of shoes in that physically it might take a few days to get used to how they feel in your ear canals. Beyond that, it might take a few days to a few weeks to get used to the sound quality, especially if you've never used earplugs before. As I always say, you've been training your whole life to a very individual, specific frequency response that's unique to you. And what I'm talking about is the ear canal response, your own resonance. Even if you have the best filtered earplugs in the world, these are passive devices and they have a flat frequency response to a certain degree, but it is going to sound different than your open ear. So I highly encourage you to take some time to ear train to these, practice with them, listen to music with them before you start wearing them for gigs or performances. Moving on to insertion. When you look at the earplugs, one will have a red dot. You can see it right there. And one will have a blue dot. And I'm going to show you the blue dot here. Okay, the red dot is for your right ear. R&R. The blue dot is for your left ear. One of my favorite phrases I heard from a former student of mine, she would always say, "I'm blue because you left me." And that's how she would teach her patients how to remember the sides for the earplugs. If you're like me, perhaps you got two different colors, so you can tell them apart more quickly. So you can kind of memorize which color you have for which ear. For insertion, I'm going to go through the earplugs first without the connecting cord. And then I am going to show you with connecting cord. So if you're someone who has them connected, don't worry, we're going to talk about that too. To insert the earplugs, I like to think dot down. So that dot that I showed you toward the ground. And what you're going to do is put the end of the earplug, so the side with the hole where the sound comes out, into your ear with the dot down. You're going to put it into your ear canal, and then you're going to slightly twist back, sort of like you're taking a drink. Okay, and once it's in your ear canal, it will look like that. Okay, I'm going to take it out and show you again. If you're someone who has really curvy ear canals and you're having a hard time getting the earplug in, sometimes it helps to start with that dot a little bit more toward the back of your head. So I'm going to show you that. If I start with the dot toward the back of my head and I insert, it's more of a twist. I can get that hook in there and I can twist back. Okay? It's a really quick process. Don't worry, the more you do it, the quicker it will be. So you need to practice this too. So if you're in the middle of a gig and you have to quick put an earplug in, you know how to do it. So when that earplug is in, let me show you removal. If you take that earplug and get behind it, behind the silicone, and then do an opposite twisting motion where you'll twist toward your nose, like that. Okay, so I just did that really slowly so you could see it. So let me do it again. So my earplug is in. I'm going to remove it. I'm going to grab the back and I'm going to twist it forward and remove it from my ear. If you remove your earplugs and you see wax on them, it's fine. As we've discussed, wax is good for you. It's healthy. You can always take a Kleenex, a dry Kleenex, or perhaps something that is non-alcoholic, like a non-alcoholic wipe, and you can wipe the wax off. Okay? So that's insertion and removal without a connecting cord. I want to go over with a connecting cord now. I have my pair here. I don't have my filters in. I'm just going to show you insertion and removal with these. And let me do it with the opposite ear so that you can see how it looks to put something in your left ear. So I'm going to take my left earplug with the connecting cord and I'm going to hold the silicone and do the same process. I'm going to put this in and twist. And that cord is going to exit right here, right at the base of your ear. And if you want to use that in terms of knowing where to start the earplug, that's fine, because your dots, your right and left dots, are going to be in a little different place when you have a connecting cord. So if you take this, put the cord down instead of dot down, put it into your ear canal and twist back. When the plug is in, it should feel snug. You should feel like you have an earplug in. Things will sound a little different, and especially your own voice. Anytime you put anything into your ear canals, it's going to change the way you sound to yourself. Okay, so again, part of that ear training process. When you remove it, you're going to grab the silicone, okay, and twist forward. The same as if you didn't have a connecting cord. Something you do not want to do is pull on this cord. Okay, so you don't want to remove it by yanking on this or you will break the earplug. You want to take the back of the plug and twist forward. This cord is removable. Okay, so you can actually take this, take it out of the silicone, okay, and you can put it back in. I would caution you to not do that very often. And again, to not remove the plug from your ear with the cord, because I'm going to show you what will happen. The silicone, rather than being totally around the connecting cord like it is with this one, it's going to split like this, okay? And then the cord might not stay in at all. You might have to glue it. You might have to contact me and say, oh my gosh, my silicone split, I need a new pair. So protect that sort of connection. Don't be too rough with it. Now, in terms of cleaning the earplugs, you don't have to clean them every day. You do not have to clean them every time you wear them. It's an individual thing. It's what you're comfortable with. If you have something like an active outer ear infection going on, obviously you'll want to clean them frequently, perhaps each time you wear them, so that you don't keep putting that back into your ear. For me, I'll clean mine every few months, and I'm going to tell you how to do that. These filters that are on the earplugs are removable. How to remove them is you take the earplug, you kind of squeeze the silicone a little bit. Let me show you up here, and the filter will pop out, okay? And then you have the filter here. You do not want to wash the filters, okay? So you always want to take the filters out before you clean the earplugs. You're going to be left with this silicone shell that was holding the filter. You'll wash this with hot water or warm water, okay, and dish soap, like a dish detergent, a degreasing detergent. The reason for that is you actually want to pull the body oils out of this. The main reason I clean my earplugs and wash them is to keep the filter fitting tightly, okay? Over time, you might notice that the filter will get kind of loose in this silicone from your body oils getting in there. When you remove the filter and you scrub this with dish soap and warm water, let it totally air dry, you'll notice when you put the filter back in that it will fit more tightly. Okay, that's important, I really think, especially for people who are using these and taking them in and out quickly. You want to make sure you have that tight connection so that if you quickly take it out, you're not going to lose your filter. Okay, so something to keep in mind. If you have any questions at all, you can contact me. My email address is heather@soundcheckaudiology.com. And I want to remind you that these are wonderful things. You can use them to lessen your exposure to sound. But as I always say, it means nothing without knowing an audiologist and getting an annual hearing test to check up on yourself.